Okay, everybody, thank you for joining us today. We are pleased to be able to offer this webinar on the Affordable Care Act and the Special Enrollment Period. Very grateful to New Jersey Citizen Action for joining us. We are going to I'm going to tell you a little bit about the center, and then I will give you some more information. Hold on, I'm trying to get this to, there we go. Trying to get to where I can advance. All right, that's better. Okay, so this is the free webinar on the Affordable Care Act enrollment. This session is in English, and at 7 o'clock we will repeat the session in Spanish. So I want to thank everybody for attending. This center, I'm Debbie Duncan with the Center for Nonprofits. I'm the Director of Education Services. The Center for Nonprofits is, our mission is to build the power of New Jersey's nonprofits to improve the quality of life for the people of our state. And we do that in several different ways. Advocacy and public education is absolutely critical. We monitor legislation. We advise our legislators and policymakers on policies that affect the nonprofit sector. And we educate the nonprofits about what that means and what benefits and what difficulties that they may present. We do some research also that we make available on our website. Mostly we do capacity building, which is what this webinar is all about. We do education programs for professional development, management, compliance, and we also produce some publications with information for people on nonprofit management. And finally, we are a membership organization. We have an e-newsletter. We have resource lists that we give people when you're looking for assistance. And we also have some cost-saving benefits. Finally, we are not alone. We serve, the Center for Nonprofits serves New Jersey, but we have sister associations across the nation, and we form a network with the National Council of Nonprofits. So now I'm going to thank you for attending and give you back to Shalini Rajput, who is from the New Jersey Citizens Action, to present the information that you're waiting to hear on the Affordable Care Act and how to enroll. Thank you, Shalini, for being here.
Thank you so much, Debbie. That was so beautiful, and we do need something like that to hold us all together. With that, once again, thank you for having me over here, and thank you, Sharuk and Sergio, for organizing this. Hello, everyone. My name is Shalini. I am from New Jersey Citizen Action. That is another nonprofit organization, and I will talk more about it in a little bit. So let me share my screen first, and then we can talk more about what I'm going to say. So like Debbie said, our topic for today is ACA open enrollment, basically open healthcare enrollment. But before I talk about it, let me just give you a brief idea about our organization. The name of our organization is New Jersey Citizen Action Education Fund. We are primarily based in Nueva, but we have offices in Highland Park, and we just opened a new office in Elizabeth as well. Our organization provides many free services. One of them, and the one that is being very much useful for now, which I'm talking about today, is healthcare enrollment assistance. But we're also providing help with eviction protection program, tax preparation, financial coaching, first-time homebuyer counseling, fair housing discrimination, and oil group. And all these helps are absolutely free of cost. So anybody, somebody, if they need any help or they need more information in this regards, they can get in touch with us. I will provide the contact information at the end of this presentation, and I will also send those information to Sergio, Sharuk, and Debbie. So if you guys are interested, do get in touch with them, and in turn get in touch with us. You can also look for citizen action at njcaef.org. Do find us on Facebook and Twitter and Instagram, and you will find, I'm sure you'll find very informative information. The most important thing is that most of our services are free, and we are able to provide information by phone. Most of the services we are able to provide by web conference as well. So we can reach technically anywhere in New Jersey by phone. I can say thanks to pandemic for that. Coming back to our topic, healthcare enrollment. So we are talking about ACA healthcare enrollment, which is primarily being provided by Marketplace for state of New Jersey. So most of you would be aware of healthcare.gov, which is the ACA program for through federal government. Until last year, most of the New Jerseyans were enrolled in healthcare.gov as well, but GetCovered NJ or Marketplace does replaces that for residents of New Jersey. So everybody who was a resident of New Jersey and those who were enrolled on Marketplace, on healthcare.gov, were transferred to Marketplace GetCovered NJ. So any New Jerseyan who does not have coverage or is looking for affordable coverage can look for options on Marketplace. I have been doing this since the GetCovered NJ start, and I can say that people have benefited a lot from this. It's something that is worth finding out and worth checking out. But before anybody does that, or before anybody starts looking for any kind of healthcare in that reason, I would suggest that there are a few things that they need to keep in mind. First of all, why is healthcare is important for me? Now you're going to ask me, Shalini, why are you asking this is important? Of course, it is important, but you should know that why is it important for me? Do I have an ongoing situation that needs coverage? And keep in mind, for Marketplace, if anybody has a condition that is already there, an existing condition, they will not be denied. They will not pay any amount higher than anybody who does not have any condition. They do not differentiate. That's the biggest advantage of Marketplace. So there could be somebody who has condition that needs taken care of. Their need would be different from somebody who just need healthcare because they want to keep everything in check, and they want to have health coverage because they want to get their annual checkup done, their screening done, their well visit taken care of, and just to make sure that if anything goes wrong, we have the coverage. That is why I say, why is it important? What is my need and I want? Do I need a coverage for one person? Do I need coverage for whole family? There could be families where a person who has the job gets coverage from their job, but their job does not cover their family members. So they should keep that thing in mind also, that, you know, what is my need and what are my choices? And yes, you have choices on Marketplace. I have submitted so many applications, and every application at least have 15 choices to choose from. You're not assigned a coverage. You will choose it from there. You will choose that which provider do I want to go for, how much copay I want to pay, how much deductible do I need to pay if I have to pay anything. Last but not least, how much will it cost? This is what I always say. Please make a budget for yourself before you go for shopping. This goes for anything else pretty much, but since we're talking about healthcare, yes, you would want to keep your set expenses aside, the fixed expenses, and then you would want to make sure that I know that this much per month I can, if I need to, spend on my health coverage. That way you will have an idea once you are enrolling in a plan, in case you have to have any kind of expenses, that this is what I can afford. So this is the plan that I can go for. So you can narrow it down that. Now the questions comes, when can I enroll? The enrollment had started from November 1st. We are in the almost last phase. January 31st is the last date. So we still have about less than a week, but there is time. 7 days is still time enough to put your application through and get the coverage. If anybody you know, or if anybody you are helping out, your organization is helping out, you think that they can get benefit from this, do provide this information to them as soon as possible. We are trying to help. The application is online and we're just trying to have the word as much out as possible so that people can have coverage. I still talk to people who say, I wasn't aware of this. Where were you all this time? I'm like, I'm here, you don't know about it. So please market, please let people know that, these things are there, these options are there. Now the question comes, what happens after January 31st? It is, we will enter in a special enrollment period that will run until October 31st. To qualify for that period, there needs to be some kind of major life-changing event, something like loss of a job, or in that term, change of a job. If somebody had a full-time job and they had a coverage from job, all of a sudden, for some reason, the company downsized and now their job went to part-time or hourly for that matter, and now the company says we cannot provide you health coverage. That is something that they can qualify for special enrollment, and in that case they can look for coverage in marketplace. There is a death in the family, change in the size of the family, change in immigration status or citizenship, somebody who did not have a status now gained, or somebody who came in United States sometime in May, June, March, that time they would be qualifying for coverage. Or somebody just put in the papers and they're waiting for their papers to come through. Somebody just got married or divorced. There is a new child in the family. Pregnancy, this is very important. Until last year, a new pregnant woman would, if she does not have coverage, I believe they had the emergency coverage through Medicaid. Now, anytime a woman gets pregnant, she can get coverage from marketplace. She can apply right away, anytime during the year for marketplace, and she can, based on her eligibility, she can get coverage some or the other. If somebody is determined not to be eligible for NG Family Care, let's say somebody was having a coverage from NG Family Care, and now, fortunately, they are making more money, or for some reason NG Family Care coverage, they are no more eligible for it. In that case, they can shop for, they can go on marketplace on Get Covered NJ, and they can look for the coverage. Like I said, the special enrollment coverage will need special events. Those events need to be informed within 30 days from the major date. Some of the coverage can be retroactive, like pregnancy. So it's very, very important to notify as soon as possible about these changes. I'm going to make a pause here, and if anybody has any question at this point for me, feel free to ask them. All right, so silence is gold, and I believe nobody have any question. So I'll go ahead.
I do have one question, actually. So for the special enrollment period, is it the same insurers that are going to be in the marketplace as the regular enrollment?
I'm sorry, I missed your question, Sergio. You were picking up after you said special enrollment. Would would
it be the same insurers in the marketplace?
Yes, the coverage would be same, the providers would be same, everything would be same, except that the coverage will start from following date. And the coverage, how it works is, if you enroll in sometime after March 1st, the coverage will start from following month. and so forth, so on. Does that answer your question, Sergio?
Yes.
Perfect. Okay. Okay, give me 1 second. It's somehow my mouse is blocked. Okay, there we are. Now, question comes, who is eligible for marketplace? Anybody who is a resident of New Jersey can apply for a marketplace health coverage. Anybody who is a dependent and residing in New Jersey. Now, why I say dependent? Like I said, probably the main earner in the family does have a coverage from their job, but their job does not cover rest of the dependents of the family. They would be eligible for marketplace coverage. A citizen or a non-citizen who is lawfully present. So this is a very big thing on marketplace. Anybody, and we have this stigma that for any kind of benefit we should have a certain kind of immigration status. For marketplace, we need to have immigration status, but it doesn't have to be just a citizen. It can be citizen or a non-citizen, anybody who has a green card, anybody who has an EAD, anybody who has an authorized work permit, any kind of immigration status, that is it. Or if somebody has a coverage, but that coverage is not considered affordable, they can also, they would also be eligible for marketplace. If in doubt, this is what I always say, if in doubt, always put in the application and check what kind of coverage or what kind of benefits you're getting for. You just put in the application, it's not going anywhere, nobody's coming behind you. You just want to know that what kind of coverage I have, what kind of benefit I'm qualified for, whether or not this make any sense to me, whether or not this is something that is useful for me. Then you can take it from there. It does not hurt to see what your options are. We have few options. One of the options that most of us are aware of it is NJ Medicaid program, which is a free or low cost insurance. It is provided for children up to age of 19, adult 19 to 64, and someone who is living with a disability. NJ Family Care is all year long. There is no deadline, no open enrollment. Anybody who is deemed eligible can apply for NJ Family Care anytime. There are some eligibility criteria for NJ Family Care. One has to be resident of New Jersey, must be a citizen or lawfully present for at least 5 years. This is a big difference between NJ Family Care and Marketplace. For Marketplace, that 5-year eligibility criteria does not apply. And the eligibility for NJ Family Care is based on the household size, of income and size. This is where we have the question. What if somebody applied for NJ Family Care, they do not have coverage and they applied for it, and for any reason, let's say for due to immigration status or due to income, they are not deemed eligible or they are denied from NJ Family Care, what option do they have? This is the option. Get covered NJ on Marketplace. It is a one-stop shop marketplace, and I love the phrase, it is one door. NJ, state of New Jersey has one door policy. That means no matter which door you knock at, you will end up in the right place, which is the best suitable for you. How I say it, let's say you put your application on Marketplace. The application is always evaluated based on all the criteria. If someone is deemed qualified for Medicaid or NJ Family Care, their application will automatically go to NJ Family Care or Medicaid. They would not be stopped at Marketplace. Their application will automatically go to Medicaid, and then they will assess it. Again, for any reason, if that application is denied for Medicaid, they can come back to Marketplace, take it from there, wherever they left, and get coverage. So it's just one door. And it's super easy. I've been doing this and super easy. I can't say it any more. you do receive financial subsidies to help pay premium based on the eligibility and based on what you qualified for. 9 out of 10 people that I have enrolled have received some or the other kind of financial subsidies. In most cases, it has been substantial. I have seen people who I have enrolled and they were like, are you sure? Are you sure this is what I'm qualified for? I just enrolled actually somebody yesterday and they were like, no, this is not possible. I'm like, yes, it is possible. So that is a kind of subsidies and benefit you're getting. There is no extra cost to have an assister. There are assisters appointed by state. I am one of the appointed assister. We are trained and certified by state. We're trying to help. Biggest positive side, there is no cost. There is no fee at all. You do not pay me, you do not pay marketplace, you do not pay anybody. You just pick up a call, say, I need this help. We provide you the help as much as you need. We try to put in the application for you. We can put the application for you on the portal. We can submit the documents for you if required. We try to answer most of the questions. If we don't have the answer, we try to find them for you. So you have your own personal assistant, and I'm not kidding. Yes, the website for marketplaces Get Covered NJ. Please go online and do check it out. It is very, very, very helpful. The application itself is very simple and self-guided, so you can definitely put an application anytime if you have any questions or you come across something. Oh, what can I do here? I don't know. Should I put this or would this be right or wrong? Call an assister. Literally every page have an option for you to take you to assister. You can just look for assistance and take it from there. There are 4 major providers. Like I said, there would be options. So the options do come from these 4 providers: WellCare, Horizon, AmeriHealth, and Oscar. And each of them do provide many options for you to choose from. When you're doing your, when you're putting in your application, you will come across the word much often called advanced premium tax credit. It is the tax rate given to you in advance to lower the monthly premium. Most and foremost important is to be honest about it. Be honest about the income when you are filing the application, or if you're filing the application for somebody else. It is very, very, very important to be honest about the yearly income. The amount that you receive as premium tax credit is based on the household income for the year that you're filing the application for. This should be 2022. If somebody has predicted lower income, they may owe money at the end of the when filing taxes. When they have higher, if they predict a higher income, they may receive money back. One of the important things is that you do not have to accept all or any of the advanced premium tax rate. If you think that no, I'm good without that, I'm good without APTC, I do not need it, or I can just use a chunk of it, I'm not sure if this is what I should be doing, then you can just reduce the amount and then take it from there. Another important thing, and if you know that anybody have had marketplace last year, or if you're having it now, when you're filing your taxes for the year that you had the coverage from marketplace, it is very important to be honest about how much amount you have received for premium tax credit, and you would need to disclose that on your taxes. I come across this question many times when people do see their benefits. They're like, how is this possible and why is this there? It is because there is something put in place, and I'm sure most of you would have heard of it. It's called American Rescue Plan Act, which was put in place in April 2021. The financial subsidies were increased based on that. There were subsidies before as well, before April, but after April 2021, there was huge difference in subsidies, and that is still carrying forward in 2022. That was because of the pandemic. Like I said, 9 out of 10 people do qualify for some or the other subsidies, and no one pays more than 8.5% of their income, total income, for the marketplace. Just to give you an idea, if an individual is earning an income of 77,280, 1%, keep in mind 1% for the year, they would qualify for some or the other financial subsidies. Similarly, if there is a family of 4 and they have income of 159,000 for the year, which is quite a good amount, they may qualify for some of the other subsidies. So this is just to give you an idea that how much the range, how wide the range is, and it is real. For those who had the coverage last year, their application had automatically been renewed. But this is to keep in mind, the unemployment benefit that they were receiving ended on December 31st. So just to give you an idea, those who were receiving unemployment benefit were paying about $0 premium. Like, I actually have had application where people were paying 20 cents, $2 per month, something like that, and I'm not exaggerating, definitely. So if you are helping somebody and they say that we were paying this much and I'm still receiving unemployment, or I'm still unemployed, that benefit expired on December 31st. But still, subsidies are way too much. I'm still seeing people paying much less, and you will see it soon. I will give you an example right after this. But coming back to the last year's renewal, any information that was changed after October 14th would not have been renewed in the last year's application. So if you know somebody, or if you had application which was put in last year and you think, oh, I'm good, it has already been automatically been renewed, I got an email, everything is good, please check it one more time. Please go back into your account and check it back. The new information may not have been updated if it was after October 15th. Also, I do stress on this, check for plans. You may have been renewed on the last year's plan, but it doesn't hurt to check if you have something better. You can always have something better, and we always go for the best deal, right? I'm all for deals all the time. And double check your premiums. So even if your application has been auto renewed, please check everything one more time. Now, this is what I was talking about. This is a snapshot of somebody we helped. Coverages for this year. It started on January 1st. The coverage they will have until December 31st. Status was saying pending because at the time snapshot was taken. Insurance was still reviewing the information of people who were enrolled. I'm sure it is now confirmed. The monthly premium they were supposed to pay was $563. The APTC, remember we talked about advanced premium tax credit, APTC, they chose was $562.29 per month. This is per month. They received benefit from state of New Jersey as well, since there was no gap, nothing else to fill in. All they could get was $1, but I'm sure the benefit was much higher. How much they are paying net premium? $0, nothing. And this is real time. This is absolutely real time. This is somebody's benefit. This is what people are getting, and this is how I say that people have been like, really, is it true? So if you know anybody who you think can get this kind of benefit, and you think who do need some kind of coverage, please encourage them to check this out. Like I said, certified assisters are properly trained and certified. We have assisters. I am one of the assisters. We have 2 more assisters. We speak English, Spanish, and Hindi. We are able to navigate through Get Covered NJ and NJ Family Care both. We are able to submit the application on anybody's behalf on Marketplace and NJ Family Care. We are able to upload the document. It is free of charge. It's no cost. And most important, the help is absolutely unbiased. Our goal is in the benefit of person who's enrolling. We are trying to help people get the best coverage and best benefit they can. Just a few terms to go over when in terms of health insurance. You will come across these terms when filling the application or when deciding the coverage. Premium is the amount one would pay monthly for the health insurance. It is just like the car insurance. We pay monthly an amount, a set amount will be. Deductible is the amount one must pay before the health plan begins to pay for services. For the services, deductible applies. Preventative care is 100% covered for all the plans on Marketplace. No matter which plan or which coverage you choose, all of them will take preventive care as absolutely 100% covered. Co-payment is the amount of fees one will pay every time you see the doctor. This is the amount usually listed on our insurance card. It will say PCP this much, special this much, like $10, $15, $25, and then that is the amount we'll pay every time we see a doctor. Co-insurance is usually the percentage portion of the cost that we pay for care after you meet the deductible. It's usually the amount that how the insurance company says, my insurance is 80-20. So 20% is the co-insurance that the person who's insured will pay, that we will pay. So something is like 80-20, 90-10. So 90% is insurance will pay, 10% is the one who's insured will pay. That is the co-insurance. So assuming that we are all set, we have taken our cover, we have put in our application, gotten our coverage, got our insurance card. Now it's time to make doctor's appointment. You want to go to the doctor and get your checkup done or get your healthcare done. Your neighbor had gone to a doctor and they said, oh, Shalini, that doctor was awesome and they have taken care of me like everything. They found everything and I'm so happy. And you just want to call that doctor and make that appointment. Hold your horses. Before you make that call, make sure this doctor is in your network. How you want to make sure, how you can make sure? You can call the health insurance company, the one who's giving you coverage, give them the doctor's name and information, and ask them whether or not this doctor is in my network. Or you can check the healthcare insurance website. If you don't want to do that, you can call the doctor's office who you want to go to and give them your healthcare information and tell them, this is my insurance. Will you be in network? I am stressing on in network because you get the best of your benefit when you go for in network providers. And with the Marketplace coverage, I have seen the coverage is huge. Huge. So many people come to me and say, Shalini, I want to keep my doctor in my plan. The doctor that I have been seeing for so many years, I just want to make sure that they are in my plan. Trust me, 90% of the time they do get their provider in one or the other coverage. So make sure that you try your level best to go to the in-network providers. Like I said, in-network is the doctor or office which has contact with the health services plan. Out of network is the doctor or offices who do not have contract. You will also come across a word called referral, which is nothing but most of the times, some of the times I would say, the specialists do need coverage, your specialists do need referral from your primary healthcare provider. So that is the word that you would come across. That makes that brings me to the end of this presentation. As of now, before leaving, I will say 3 things: why I need it, what is my requirement, and how can I pay and how can I choose. Be honest, be honest, be honest about your income. And last but most important, please obtain health coverage. Some way or other, obtain a health coverage, use affordable health insurance, we are get covered in jail. And I promise in starting, I will share this information about all the services that Citizen Action provides. These are the contact information. I will leave this slide on for a while. I will also share this slide with Debbie, Sergio, and Sharuk, and they can share with you guys or whosoever is interested. And after this, I will share the slide for ACA enrollment. You can call on this number, or anybody who you suggest, they can call on this number, leave us a voicemail, and then we will get back to them. We will make an appointment with them at their time suitable, and we can take it from there. We can also do a virtual appointment where we can show them we can share them screen with them and show them what we are doing, explain them everything. They can see somebody face to face. Or even better, we have in-person appointment now at 171 Almora Avenue. It is by appointment, but people can come in person and do the enrollment.
Okay, Shalini, there is one question in the chat, which is there a list of services that the insurance covers? I'm not sure if that varies with the provider.
So the services are pretty much everything, and all the providers do provide all of them. It's not that the one provider provides one thing, one provider does not provide one thing. So you have an option to go to your primary care, option to go to your specialist, get the lab work done, get the X-ray done, MRI done, hospital coverage, emergency coverage. You also have coverage for rehabilitation services. What else am I missing? It's basically everything that you can expect from a health coverage. This is not limited coverage. This is everything. Any other question?
Thank you for sharing. I just wanted to add to that question. So it's access to everything, but your primary doctor would have to kind of provide you with a prescription stating, here's an example, like alternative therapy or occupational therapy, physical therapy. So you'd have to get a prescription from the doctor specifying why you need this. And do they?
Sorry, you're talking about referral?
Yeah.
Not all the time. Depends the kind of coverage, depends the kind of plan you choose.
Okay, gotcha. Thank you so much.
Not a problem. And you can let your assistant know if you are taking help from somebody. You can let them know that whether or not I want a referral plan. Some people do say that we do not want referral plan. That's it. So you have many options. I just helped somebody yesterday and they had a few lists. I don't want this, I don't want that. We kept on filtering, and then we filtered to a level where she was like, okay, here I can make my decision. Any other question? Wow. Either I was too fast or I was too good.
Quiet group.
Quiet group. So like I said, if anybody comes across any other question, this is my information and I will share with Debbie, Sergio, and Sharuk again. And you can take this down as well. If you are not comfortable asking a question in the group forum, feel free to call me separately. If you are helping somebody, provide them my number, our number. And then we're just trying to help as much as we can. Like I said, this is the last week. And we're just going with full force.
I think the important thing too is those of you who are with organizations who deal with the public and populations that in particular might need this service, is to get the word out, to your staff, to people that and for that matter, your colleagues in other organizations in the community. As I said, I will make this. I'll try to get this recording out to you tomorrow. And we can, and I'll include the information that's in these slides, so you don't have to write everything down, but we'll get that to you as soon as possible. And then you can, share it also. This is all public information. So, please feel that you can share it with anybody who might be able to help reach people who really need this service. Okay. Okay, so now you see seguro médico en Nueva Jersey. Okay.
Sí.
Bueno, el Center for Nonprofits es una organización que apoya a organizaciones caritativas en el estado de Nueva Jersey. Nuestra misión es fortalecer el poder de la comunidad caritativa en Nueva Jersey para mejorar la calidad de vida para el pueblo en nuestro estado. Lo realizamos mediante actividades incluyendo abogacía y educación pública. Nos reunimos con legisladores para asuntos de política y cómo afecta a las organizaciones caritativas, y educamos a las organizaciones y el público. También realizamos algunas investigaciones, 2 o 3 por año, sobre la comunidad. Creación de capacidad es en gran parte lo que hacemos, webinarios, seminarios, conferencias educativas, educación profesional. Nosotros estamos de educación sobre el manejo de las organizaciones, no de las actividades. O sea que nosotros no tratamos de manejar comida, de mejoramiento del medio ambiente, etcétera. Es para apoyar la organización. Presentamos asistencia directa de gestión y de cumplimiento legal, y también producimos publicaciones para las organizaciones sobre las mejores maneras de manejar su organización. Somos una organización de membresía, y los miembros, ayudamos a todo el mundo. Los miembros reciben ciertos beneficios, más información, más listas de recursos y referencia, y también beneficios de costo, de ahorro de costos. Todos los programas que presentamos, en la cual cobramos una tasa, los miembros reciben al mínimo el 30% de descuento. También somos parte de una red nacional de centros parecidos y centros hermanas en la mayoría de los estados, y nosotros organizamos bajo el Consejo Nacional de Organizaciones sin Fines de Lucro, el National Council of Nonprofits. Y eso nos da más poder, más habilidad de abogar, en particular a nivel federal, también a nivel estatal, para políticas que apoyan al trabajo de las organizaciones caritativas. Ok, ahora les voy a pasar a Carla Cepeda, que va a hacer la presentación de New Jersey Citizens Action.
Ok, muchas gracias Debbie por presentarme, y muchas gracias a todos ustedes por estar con nosotros hoy día. Y como Debbie dice, hoy día voy a hablar sobre el seguro médico y New Jersey Citizen Action, y explicarles un poco de todo lo que nosotros hacemos en nuestra organización. Y también gracias a Sharuk y a Sergio por hacer esto posible también. Déjenme llegar para que puedan ver la presentación conmigo. Ok, pueden ver lo que tengo acá? Sí.
Sí.
Ok, perfecto, gracias. Ok, so, básicamente la inscripción abierta comienza noviembre 1 y termina ahora en enero 31 del 2022, así que quedan unos días para poder seguir aplicando para el seguro médico. Es New Jersey Citizen Action Education Fund y qué es lo que nosotros hacemos. Nosotros somos una organización sin fines de lucro de base estatal que pelea por la justicia social y económica. Nosotros tenemos muchos servicios gratis. Tenemos lo que es la asistencia en la inscripción del cuidado de salud, que es lo que yo hago. También la preparación de impuestos. Tenemos programa de protección contra desalojos, consejería financiera, consejería y más para nuevos dueños de casa. También tenemos un programa de discriminación de vivienda justa y un grupo de petroleo. También pues nos pueden visitar en la página web en njcaf.org para poder pues ver todos los diferentes tipos de programas que nosotros tenemos. Hazte cargo de tu salud, básicamente esto explica que por qué es importante tener el seguro de salud, por qué lo necesito, por qué sería una buena opción para mí, qué es lo que necesito, básicamente qué son los diferentes tipos de documentos que se necesitan, cómo pudiera calificar, cuáles son mis opciones, alguna pregunta puede ser cuánto me costaría, cuánto puedo pagar, qué es lo que puedo yo poner de mi bolsillo cada mes, porque todos sabemos que tenemos responsabilidades, así que puede ser que tener un seguro de salud, sienta usted que puede ser muy costoso, entonces nosotros le ayudamos a buscar lo que le puede servir un poco mejor. ¿Cuándo puedo escribirme? Básicamente, como dije, el periodo que le llamamos la inscripción abierta comenzó noviembre 1 del 2021 y termina ahora en enero 31 del 2022. También tenemos el periodo especial de inscripción. Esto comienza febrero 1 y termina hasta octubre 31 del 2022. Pero para poder calificar para el periodo especial, tiene que tener algún tipo de evento importante que lo califica para este periodo. Pero estos eventos podrían ser tal vez la pérdida de un trabajo, la muerte de un cónyuge, también cambio en el estatus inmigratorio o la ciudadanía, recién casado, divorciado, nacimiento o adopción de un niño, embarazo, si usted se muda de otro estado, también si usted se inscribe para New Jersey Family Care y lo niegan, usted ahí también puede en ese momento aplicar para el Get Covered New Jersey y nosotros podemos asistirle con eso también. Algo que es muy importante saber durante este periodo de inscripción de inscripción especial, usted tiene 30 días para reportar alguno de estos eventos. Entonces, vamos a decir que usted perdió su trabajo hoy día o empezó un nuevo trabajo, por decirle así. Usted tiene 30 días desde hoy para poder pues reportarlo al Get Covered New Jersey y así pues tratar de inscribirse en algún seguro médico. También es importante saber que puede recibir cobertura retroactiva a la fecha del evento importante. ¿Quién es elegible para básicamente el seguro médico? Serían los residentes de New Jersey sin seguro médico, también dependientes sin seguro médico residiendo en Nueva Jersey, cualquier ciudadano residente que esté legalmente en el país y si el plan de seguro médico que tiene no es considerado asequible, puede calificar. Entonces, eso también incluye a las personas que tengan seguro médico pues por parte del trabajo. También en este tiempo usted pudiera chequear si califica para uno de estos planes y tal vez le sale un poco más barato también. Entonces, en Get Covered New Jersey, nosotros le llamamos lo que es One Stop Marketplace. Básicamente, usted en este Get Covered New Jersey, usted puede recibir subsidios también financieros para ayudarle a pagar su prima. No hay ningún costo adicional para tener ayuda de uno de nosotros, algún representante. Y también cuando usted pues ya termina alguna aplicación de Get Covered New Jersey, al final le muestra básicamente una a 3 páginas con diferentes tipos de seguros médicos que usted puede elegir, como Horizon, AmeriHealth, Oscar, WellCare, y en fin, tienen muchas diferentes opciones. Es importante saber también que usted puede ser que califique para un crédito fiscal que puede tomar por adelanto para reducir su prima mensual. Pero es súper importante ser lo más honesto posible que pueda, porque todo básicamente depende en lo que usted reporta en sus taxes. Así que este crédito fiscal es básicamente un monto de su crédito fiscal para la prima, depende de los ingresos familiares estimados para el 2021. Esto quiere decir que si usted reporta que va a tener ingresos altos, puede ser que usted deba dinero. Y si usted reporta que va a tener ingresos bajos, puede recibir dinero de regreso en los taxes, ¿ok? No tiene que aceptar lo que se le llama Advanced Premium Tax Credit, como se le llama en inglés. No tienen que aceptarlo todo, puede agarrar, vamos a decir, la mitad, pero eso le ayuda pues a que su prima sea más baja cada mes. Así que recuerde que tiene que ser honesto cuando llene sus taxes para evitar alguna penalidad. Recuerda también que es importante reportar su ingreso y los cambios en el hogar para evitar también una penalidad. El plan de rescate americano del 2021. Este plan pues provee más ayuda financiera. 9 de cada 10 residentes de New Jersey calificarán para subsidios financieros. Nadie paga más del 8.5% de sus ingresos. Eso quiere decir que para una persona es $77,280 y si alguna alguna familia de 4 sería el límite tal vez de $159,000. Así que es bien grande la cantidad, que significa que muchas personas pueden calificar. También tenemos lo que mucha gente conoce como el Medicaid. Este es el seguro gratis o de bajo costo para residentes, para personas aquí en New Jersey. Las personas son niños de 0 a 19 años de edad, adultos 19 a 64 años y personas discapacitadas, ¿ok? Eso quiere decir que usted podría también aplicar en New Jersey Family Care. La única diferencia de Get Covered New Jersey a New Jersey Family Care es que New Jersey Family Care usted puede aplicar durante todo el año. Y en Get Covered New Jersey, lo único es que todo el mundo podría aplicar durante el periodo abierto que está ocurriendo ahora. También es bien importante que sepan que nosotros también le podemos asistir con la aplicación de New Jersey Family Care. Le ayudamos en el proceso de todo eso. Así que aquí estamos pues para poder asistirles aplicando con alguna de estas dos seguros médicos. ¿Okay? Para ser elegible para el New Jersey Family Care, tiene que ser residente de Nueva Jersey, ser ciudadano estadounidense o tener el estatus de residente legal permanente por 5 años. Eso quiere decir que aunque usted haya vivido aquí en los Estados Unidos, vamos a decir 10 años, pero si no tiene esa legalidad, esa residencia desde hace 5 años, no pudiera aplicar. Entonces es bien importante recordarse eso, que tiene que tenerlo por 5 años. También tiene que tener ingresos dentro del estándar apropiado para el tamaño del hogar. Cualquier también pregunta, ustedes también pueden llamar al New Jersey Family Care y el número está acá abajo. También tenemos algunas buenas noticias para las personas que son indocumentadas. Si alguna persona está embarazada, hay algunas excepciones y esas excepciones son básicamente que estas personas sin estado de ciudadanía o inmigración, pero deben cumplir con el resto de los requisitos de elegibilidad. Entonces, si usted está en su tercer trimestre, usted pudiera aplicar para el New Jersey Family Care y pues recibir básicamente seguro médico de emergencia y que esto básicamente le ayuda para pues lo que es el parto. Okay. Usted tiene también 3 meses básicamente para aplicar después de las 36 semanas, 38 semanas, lo que es el tercer trimestre, usted pudiera aplicar para el New Jersey Family Care. También puede ser elegible para el programa de atención prenatal suplementaria de New Jersey, que es básicamente que tal vez le aprueben para algunos pagos de las clínicas o igual para lo del parto. Ahora, en el 1 de julio del 2022, los niños indocumentados se inscribirán en un programa que proporcionará seguro médico. Así que es pues un avance, se puede decir, para las personas indocumentadas y más importante para los niños indocumentados. Okay. También está lo que es la ayuda de seguro para las personas indocumentadas también. Es importante informarle al personal de la oficina del hospital que desea solicitar a este programa. Si hay un formulario de solicitud, es bien importante llenarlo lo más pronto posible. También casi siempre si usted va a alguno de estos hospitales, llévese cualquier papel que usted tenga, documento, y pues preséntelo también, porque pues así no está yendo una y otra vez. Mejor hacer todo una vez cuando usted va y tener pues a la persona que le pueda ayudar directamente. Debe completar una solicitud durante los 3 meses posteriores a la fecha de la emergencia. Así que es buena información saber. También pues tenemos el Fondo para Personas de Nueva Jersey excluidas. Es un fondo del gobierno estatal para dar pagos directos a personas excluidas de los alivios federales. Un hogar o individual puede recibir entre $1,000 a $2,000. Esto básicamente es para las personas que se excluyeron de los cheques de estímulo federal que se recibió ahora durante el COVID. Esto es básicamente para las personas que fueron impactadas por el COVID. Los ingresos del hogar de $55,000 o menos califican, y prueba de residencia, identidad y edad son algunos de los requisitos, pero es importante saber pues que esto termina ahora el 31 de enero, así que si usted conoce de alguien, pues aquí abajo está la aplicación donde podría recibir este tipo de ayuda también. Para más información y recursos para personas indocumentadas, también tenemos muchos centros de comunidades aquí en Newark, o centros de salud. Lo voy a dejar un momento acá en la pantalla si alguien necesita tomarle foto, o también yo se lo enviaré a Debbie y a todos los demás para que pues lo puedan repartir. Okay, voy a pasar la próxima. Como les decía, entonces, lo que nosotros hacemos se le llama básicamente el asistente de aplicación certificado. Nosotros somos certificados y capacitados para poder ayudarles con la aplicación. Asistimos subiendo también a cualquier documento. A veces necesitan verificar, vamos a decir, prueba de empleo, pago de empleo, perdón, o algún documento. Usted nos puede enviar y nosotros lo subimos a su aplicación, porque sabemos que a veces pues es un poco difícil navegar estas páginas. Okay. También le asistimos para aplicar en New Jersey Family Care, y todo es absolutamente gratis. Y nosotros asistimos en inglés, español, y también tenemos a alguien que habla hindi también, que era Shalini, que estuvo con nosotros anterior. Solamente también quería hablar un poco sobre el lenguaje, el seguro de salud. A veces uno escucha, oh, mi deducible aquí, mi copago allá. Entonces es importante saber qué significa cada cosa. Por ejemplo, la prima es básicamente la cantidad que usted paga mensualmente por su seguro. Es como decir, básicamente lo que usted paga para un bill de un teléfono, su seguro de un carro y así. Okay. También tenemos lo que es el deducible. Es la cantidad que se añade a su copago antes de que el plan de seguro empiece a pagar. Hay las excepciones, que son básicamente los cuidados preventivos. Esto a veces no se aplica al deducible. Tienen lo que es el copago, es la tarifa fija que usted paga cada vez que visita a su doctor. Y el coseguro es una porción del costo que usted paga por sus cuidados médicos. Okay. Sepa quién acepta su plan. Está lo que es dentro de la red y fuera de la red. Entonces, básicamente, dentro de la red es el que a mucha gente pues les conviene más. Es básicamente lo que su plan sí paga. Lo que es fuera de la red básicamente no tiene contrato con su plan médico, así que puede pagar más de su bolsillo. Es importante saber también que alguno de estos planes sí necesita una referencia para poder ver a algún especialista. Entonces, puede ser que cuando usted vaya a su médico primario, pues él o ella le haga una receta para que usted visite, vamos a decir, a un quiropráctico, un doctor físico y así. Para más información acerca de nuestros servicios gratis, nos puede visitar en newjerseycitizanaction.org. También estamos en Facebook, Twitter y Instagram. También aquí, pues, en esta página les mostramos básicamente los números de teléfono y básicamente los emails y cómo nos puede conectar. También yo voy a mandar esta información para que ustedes también lo puedan compartir con otras personas. Y básicamente también nosotros, como les decía, asistimos en inglés, español y hindi. Nosotros estamos haciendo citas remotas y también en persona. Y ahora estamos viendo a gente en persona en la 171 Elmora Avenue en Elizabeth, New Jersey. Entonces, si necesita hacer una cita, por favor, llámenos y pues nos encantaría poder ayudarlos. Mi número está acá, 908-808-2197. Si tienen alguna pregunta, tal vez no es una pregunta que tengan en el momento, pero se les venga a la mente, pues nos puede llamar y alguno de nosotros pues trataría de ayudarlos. Okay. Entonces, no sé si hay algunas preguntas. Voy a terminar de compartir mi pantalla y si tienen algunas preguntas, pues las pueden poner aquí en el chat también o preguntarla como ustedes gusten. Pero muchas gracias.
Ya que somos tan pocas, si quieren unmute y preguntar en persona se puede. Es mucha información en una forma muy concentrada. Espero que mañana puedo mandar tanto la grabación y los datos que están en el PowerPoint para que todos los puedan tener disponibles.
Gracias por la información.
Claro.
De nada.
Ujú. Y también pedimos que ustedes reparten esta información cuanto antes con sus colegas tanto dentro de su organización como otras, cualquiera que conoce que tiene contacto con personas que podrían aprovechar la oportunidad. Le agradeceríamos mucho. Y espero que ellos también le agradecerán. Con mucho gusto, Kim. Me alegro que nos pudo asistir. Bueno, si no hay preguntas, entonces le agradezco mucho a Carla. Ay, yo les quería decir unas cuantas cositas. ¿Dónde está? Ok. Primero, bueno, esto lo teníamos en el aviso que mandamos. A ver. Voy a compartir mi pantalla. Ahí está. Ok, estos son los enlaces para la asistencia para inscripción y hay más talleres, hay más vídeos sobre el cuidado de salud que están disponibles en la página de internet del New Jersey Citizen Action. También aquí en el Center for Nonprofits tenemos, mañana empieza una serie de clases sobre las finanzas, como el manejo de finanzas para organizaciones sin fines de lucro. En particular, no traducí esta. En particular para personas que no tengan mucha preparación y experiencia y entrenamiento a contabilidad y en el manejo de finanzas. Entonces recomendamos que se inscriban en la página internet de nosotros del centro. Está en el calendario. y es cada 15 días en el miércoles a la 1 de la tarde. Y después, bueno, tenemos también para los que son miembros del centro, tenemos unas conversaciones también cada 15 días los lunes para discutir asuntos de importancia a las organizaciones sin fines de lucro. También tenemos una lista para correo electrónico. Le podemos mandar avisos y noticias e información sobre los programas educacionales que tenemos nosotros. Y claro que también tenemos cuenta en Facebook, en Twitter, en LinkedIn y en Instagram. Y también YouTube. Y ahí tenemos algunas de los programas educativos que hemos presentado en el pasado. Entonces, muchas gracias a todos por asistir y muchas gracias a Carla y Sergio del New Jersey Citizen Action para hacer esta presentación muy importante para la población del estado.